I'm Dr. Rita McGuire. I'm the Chief Medical Officer here for Wakanna, as well as one of the co-founders. And each and every Wednesday, I pick a different topic to really discuss the benefits that CBD has on different ailments and disease entities that you may have on the line, or you may know someone that has issues with not only their gallbladder, but their intestinal tract. So tonight we're going to talk about how CBD can help those folks out there that have gastrointestinal disorders. So let's first talk about cannabis. If you're on the line and you may need some clarity, we're going to get clear on the difference between the different species that the cannabis plant makes. Well, the cannabis plant has over 100+ compounds. They're called cannabinoids. And these two commonly known ones are CBD, and that's what we're going to be talking about tonight extensively. CBD, or cannabidiol, which is the non-psychoactive part of the plant. What that means is that it doesn't get you high, but it gives you the health benefits and symptom reliefs that you're looking for. And then there's THC. Many of you have heard of THC. That's one that gets you high, or delta-9 tetrahydrocannabinol. So cannabis is actually broken up in two different species. One species is the marijuana species. Well, we won't be talking about marijuana tonight, but that's the species that contains high levels of THC. That's the compound that gets you high. And very trace amounts of CBD. That's the part that gets you healthy. The other species is hemp, and we're going to be specifically talking about hemp and its derivatives. Hemp is defined as containing very trace amounts of THC and larger amounts of CBD, or cannabidiol. So what is CBD? I'm on a conference call, ladies. I know it's a double Dutch people in the background. I'm on a conference call, ladies. I'm on a conference call. But what is CBD? CBD is cannabidiol, and it is a naturally occurring compound found in the cannabis sativa plant. Again, we saw in the previous slide that CBD, though it can come from marijuana or hemp, it's the hemp species that is legal in all 50 states. It's the hemp species that contains the legal limit of THC, which is 0.3%. And it is that amount that is not enough to get you high. And what we see is that hemp is a very fast growing part of the cannabis industry. In fact, we have noticed that there's an explosive growth, that by 2022, that we are looking at this entire industry in generating revenues of excess of $22 billion with a B. So let's look at some of the medical or medicinal benefits for CBD. CBD, as you can see in this graph, has a long list of properties. It is an antibacterial, it inhibits cancer cell growth, it's neuroprotective, it promotes bone growth, it reduces seizures and convulsions, it reduces blood sugar levels, it reduces the function of the immune system, and we're going to talk about that. It reduces inflammation. It reduces the risk of arterial blockage, as well as it reduces small intestinal contractions. It reduces nausea and vomiting. Again, some of these symptoms we see in those folks who have gallbladder disease and those folks who have GI issues. It also slows bacterial growth, and it suppresses muscle spasms, as well as CBD can be used to treat a lot of skin disorders like psoriasis and eczema and acne. CBD is even a vasorelaxant. Vasorelaxant means it comes in and helps to dilate those vessels, not only in the heart, but vessels that are also found in the GI tract. Now, when we look at the other cannabinoids in this wheel, being 1-delta-9 THC, remember that is found in small amounts in the hemp species, but it does have some medicinal properties. It helps to reduce vomiting and nausea, release pain, It stimulates the appetite, and it also suppresses muscle spasms. When we look at the whole plant, we call it a full spectrum product. And that's important because when you look at the other cannabinoids like CBG and we look at CBC, we see that there's a synergistic effect on the body on a cellular level when we're talking about aiding and relieving so many symptoms that folks have that have GI disorders that we're going to talk about tonight. So how do these compounds work? When you take in CBD, exactly what is what we call the pharmacology? What is the system by which the body takes in the CBD and addresses the needs of inflammation and pain? Well, it does it by the endocannabinoid system. This system is a recently discovered biological system that helps the body achieve homeostasis or helps the body achieve balance. This system is actually looking for CBD and the other cannabinoids that we talked about earlier. And these receptors that are looking for CBD help to regulate inflammation, pain, anxiety, all of the autoimmune disorders, as well as GI disorders that, again, cause a lot of inflammation and pain. So when you consume CBD, those receptors that are found in the brain, the central nervous system, the heart, the lungs, the liver, the kidney, the spleen, the bowel, the teeth, even the reproductive tract, like the uterus and testicles. And you can see here on the right, there are receptors in every single organ and gland in our body that is looking for CBD to put our body back in balance. So this system was discovered in the early 1990s. We're hearing much more about this system, and this system is the way that CBD and the other cannabinoids work. So not only does it regulate and modulate appetite and digestion and metabolism, but it also regulates the cardiovascular function, inflammation and pain, our immune function, energy balance, memory, our sleep wake cycles, and even stress and mood. And we'll talk about how it does that. So when we talk about CBD health benefits for the gallbladder, as you see in this diagram, is this little pear-shaped organ right underneath your liver. So when you have issues with your gallbladder, you typically have pain in the right upper quadrant part of your abdomen. And the whole goal and function of the gallbladder is to really help you to transport bile, to help you metabolize fatty, greasy foods. That's why when you have your gallbladder removed, it's really hard to eat that fried chicken at Popeyes and any of those spicy, greasy foods because the gallbladder is not producing the amount of enzymes to break it down. So CBD absolutely can help address patients, people, family members. Maybe you on the line have issues with your gallbladder or gastrointestinal disease by addressing symptoms of healing the leaky gut. And we're going to talk about the leaky gut. Leaky gut means just that your gut, your intestinal tract is leaking toxins and bacteria into your bloodstream. Sounds pretty scary, right? But many of us on the line have leaky gut and didn't even know we had leaky gut. CBD also can reduce the pain that comes from gallbladder disease. The pain that comes from gallbladder disease is because it's inflamed, it's angry, it's infected. It also helps to support the metabolism. CBD helps to support the metabolism when the gallbladder doesn't function properly. It supports the brain health because we're going to talk about tonight how your gut is connected to your brain, and well as CBD supports the immune system. We talked about how CBD improves not only the immune system when we talk about improving your health, but the immune system when it attacks your body in autoimmune disease disorders like lupus and fibromyalgia. So leaky gut syndrome or leaky gut is a very common problem. It typically arises with symptoms of being gassy or bloaty or having constipation or diarrhea. You can become very fatigued and even have joint pain. Why? Because the toxins are being leaked out through the intestinal tract into your bloodstream, which then leads to your brain. So this typically happens because a lot of us have a bad diet, right? A bad diet of processed foods and fried foods causes the lining of our intestinal tract to be very weak. And when it becomes very weak, then we have toxins that should be eliminated through our stool is now eliminated in our bloodstream. And it starts to affect our brain. We start to become you have that brain fog, you have that fatigue, you have those GI symptoms of constipation and diarrhea and bloating and abdominal pain. So CBD comes in as a very powerful anti-inflammatory, and it reduces intestinal damage. Not only does it improve the flora of the bile, but it reduces the inflammation of the lining, which reduces the pain. So that's why folks who have Crohn's disease or ulcerative colitis or GERD or any bowel disease or even a bad infection like sepsis has much improvement with CBD. There's also that hyperactivity that we see in people who have GERD. That's when you have a lot of acid that refluxes from the stomach. Letting me know. Wonderful. Hopefully that you can hear me now. 1 second. Let's see here. So let's back up a slide. Hopefully you can see my slides now. Hopefully you can hear me. Not sure what happened with that. Very good. So we were talking about leaky gut syndrome. Leaky gut syndrome, again, can be caused by your diet. It causes a lot of inflammation and gas and pain and fatigue because we know that our gut is actually connected to our brain. So CBD is a very powerful anti-inflammatory. It comes in, it addresses inflammation of the gut. It addresses the hyperactivity of acid being refluxed into the esophagus. And it truly has been a great aid for those who have issues with the gallbladder and GI tract. So in essence, what does it cause? Gallbladder disease, GI issues cause a lot of pain. Pain can be addressed with CBD because CBD is described as an anti-nociceptive. And what that means is that CBD can come in and block the detection of painful or damaging stimuli. CBD has been shown in many studies to be more effective than normal analgesics like Aleve and Motrin and ibuprofen and Tylenol or acetaminophen and even morphine and oxycodone. Because we know that when you take chronic doses of ibuprofen and Aleve, what does that cause? It can cause irritability of the lining of our GI tract. Some people will even have a massive GI bleed from taking too many over-the-counter medications. So we definitely know that CBD can help with not only pain, but it can help with anxiety and depression in those who are concerned about the unsurmountable pain that they're in. CBD has the ability to release what we call the happy hormones, that serotonin that improves our mood as well. So let's look at the metabolism. We talked about how the endocannabinoid system plays a pretty important role in the neurological control of food intake, energy balance, energy storage, nutrient transport, and even insulin sensitivity. So CBD directly aids in the metabolism of the gut in those who are not able to process fats in those who have gallbladder disease. In fact, CBD can also help those who want to lose weight because CBD can turn white fat to brown fat, thus decreasing the risk of a lot of diseases, diabetes, hypertension, and even to help burn calories quickly. So let's talk a little bit about how your brain and your gut is connected. Well, your brain-gut connection has a big deal to do with those who suffer from gallbladder disease or suffer from GI issues. They suffer from brain fog. They suffer from depression and anxiety. Again, when your gut is not healthy, toxins are released in the bloodstream and then start to affect the brain. That inflammation in the gut translates to inflammation in the brain. So CBD supports brain health. Again, it acts on dopamine and serotonin receptors. It acts on the opioid system. It improves mood. It improves pain. And it also reduces inflammation. Lots of studies that show that CBD can facilitate a very deep and restful sleep for those who have insomnia due to pain. So that brain-gut connection also is addressed with CBD in those who have GI issues. Let's look at the immune system, because the immune system is being now affected by the inflammation in the gut. The immune system, again, has receptors that are looking for CBD to decrease the inflammation. We see that in other immune conditions like autoimmune diseases like lupus and arthritis, Parkinson's and multiple sclerosis, those people have an overactive immune system. So it's very fascinating how the endocannabinoid system knows exactly how to put the body in balance when the immune system is affected. So a little bit about reflux. A lot of folks have reflux. Approximately 10% of Americans suffer from what we call GERD. And GERD is heartburn. If you have heartburn, you take maybe Tums or Rolaids. It's a chronic condition where you have an increase of acid that refluxes into the esophagus. It can cause a chronic cough. It can cause laryngitis. It can even cause asthma. It can cause a lot of sleep disturbances. In fact, many folks who have sleep apnea also have GERD as well. Some of the causes, again, when you look at our diet, oh my goodness, that is the common denominator, right? Bad diet causes inflammation of our gut. Inflammation of our gut can lead to a leaky gut syndrome, which can cause that gut-brain axis to be compromised. So how does CBD come in and help that? Again, when you remember that CBD is one of the most powerful anti-inflammatory herbs around, we can absolutely substitute CBD for any anti-inflammatory medication that we're used to using. In fact, CBD also is a very powerful analgesic, so it helps with the pain. CBD also, in turn, again, has receptors in the intestinal tract to decrease contractions, to improve the mobility of the substances that need to move through the intestinal tract. So CBD oil for acid reflux and GERD has been studied and has been very, very beneficial in helping those who want to come off of medications, who want to come off of using chronic Tums or Rolaids, which down the line can have issues as well. So again, CBD's role in relieving acid reflux, in relieving gallbladder disease, in relieving ulcerative colitis, Crohn's disease, all of the gastrointestinal disease, those disorders are a combination of inflammation, a combination of infection, bacterial infection, and a combination of a lot of pain or nociceptive stimuli. When you bring in CBD, when those receptors become imbalanced, you can bring in CBD to bring the body back in homeostasis. So that is how CBD works in helping to decrease the secretion of acids, to decrease the inflammation, and to decrease the pain. So what we're going to do now is that we're going to talk about some of our products here at Wakanna. It's important to know that these statements have not been approved by the FDA. If you are nursing, pregnant, if you are under a doctor's care, please consult with your physician before taking CBD. CBD is a very safe and effective product when you have the right source. Not all CBD is made equally. Our products here at Wakanna are tested, and that is important. Testing is important to ensure that the product has no mold, mildew, heavy metals, or toxins that can be harmful. Our products are also compliant with the State Department of Agriculture. That means that our products are grown in the U.S. organically. Our products are also compliant with the U.S. 2018 Farm Bill. The 2018 Farm Bill ensures that CBD must be sourced and extracted from the hemp species. The hemp species, or hemp, is defined as containing less than 0.3% of THC. That is the normal legal limit of THC in the United States. So we're going to take a couple of moments now here. We are going to take a couple of moments to talk about some of our products that can be used in those folks who have GI issues, be it gallbladder, be it GERD, reflux, ulcerative colitis, Crohn's disease, whatever GI complaint that you have. We're going to talk about how you can use some of our Wakanna products. You know, our first product is a tincture. And when we speak of tinctures, we talk about a product that you place under the tongue. And what I love about our formulators here at Wakanna is that we have two product lines. We have a pure line, which is in a white label. This is what we call a broad spectrum product that contains less than 0.0% of THC. And why that's important is because some people that really want the benefits, the health benefits of CBD, have random drug screens. So this is a product that has less than 0.0% of THC. That's our pure line. Now our power line, which is a black labels, this is a full spectrum product that has all those cannabinoids that I showed on that wheel, right? And this product has a legal limit of THC, which is 0.3% or less of THC. And what I love about our products are there are different ways you can ingest CBD. You can use it as a tincture underneath your tongue. You can use it in your beverages. You can put it in your water, your smoothies, your food. Those are our water solubles. Our water solubles come in our pure and our power. We also have gummies. Gummies are a great way to ingest CBD for that inflammation and pain. Each gummy contains 25 milligrams of CBD. Each of our products, again, are vegan and non-GMO. That's really important. We have products also that are topical. And why I love topical is because those who have GI disorders have severe abdominal pain. You can use a topical along with a tincture or a water soluble You pair that together with a gummy at night, and you have a very long-lasting relief of inflammation and pain. Topicals do not pass the blood-brain barrier, which means that you can use topicals if you have random drug screens at your job very safely. We also have one of my favorite methods, which are vaping. See, vaping's onset of action is within a minute. So just imagine you're having a ulcerative colitis attack, or you're having a gallbladder attack. You're having an acute issue. The onset of vaping, using a vape cartridge, is within a minute. So within 1 minute, the CBD can reach the bloodstream and really help those who have inflammation and pain, or even contractions of the intestinal tract. We have new products as well that are butters. We have a CBD infused butter. We have spices. We also have a culinary oil. But all of these different methods of ingestion will give you the ability to consume CBD in a different manner. Now, what I recommend is starting low and starting slow. The recommended dosing when you're starting our products is simply 3 drops in the morning and 3 drops in the evening. See, the Mayo Clinic did a study, and more is not better. So 3 drops in the evening, 3 drops in the morning, 3 drops in the evening will give you about 12 to 15 milligrams of CBD on a daily dose. And most people only need between 2.5 and 20 milligrams of CBD. 1 gummy is all you need. I use a gummy at night to help me sleep. We talked about the serotonin and dopamine pathways, and the gummies will help to address inflammation and pain. Most people who have pain cannot sleep at night. So this will address inflammation and pain. Again, the topicals, all you need is a little bit of the topical rubbing on your abdomen is all you need to address inflammation. Our topicals are enhanced with USDA certified organic oils that also improve the anti-inflammatory properties of CBD. So you can see we have a variety of products. It really depends on your preferred method of ingestion. It really depends on your lifestyle. I have a very busy lifestyle, so the water solubles are my best friend. I drop it in my water, I get my CBD dose in, and I'm done. I absolutely highly recommend that if you have severe conditions, that you couple and pair the products together, meaning that you do the tinctures so that there is a long-term effect in the bloodstream. You use the topical for that local relief, and you use the vape cartridges for that acute relief. So we're going to take some questions now from the chat box. If you have questions specifically first, I want to hear your questions about any GI conditions. And then after that, I'll take some general questions so that we can really help those to get more clarity. We want to make sure that you contact the person that invited you on this webinar, right? Because we want to make sure that you get these products to those who you love, these products in your system, and those products to you tonight. So I'm going to open up this chat line. I'm going to see if there's any questions on the chat. You can put them right in this chat box. You can type it right here, your questions, if you have them. Just like that, you can, yes.
I'm going to be vacuuming.
Oh, can you give me 5 minutes? Just 5 minutes?
Yeah.
We're going to finish this call. Are there any questions on the line? Now, I see some in the Q&A area. Are there any questions as it relates to the GI tract, gallbladder, ulcerative colitis, Crohn's, GERD? Great, thank you so much. One question, will this help with a colostomy bag? So someone that has a colostomy bag, CBD will absolutely help some of the symptoms that those folks are having. Whenever you deal with a chronic traumatic issue, having a bag, CBD will actually help the mood, your anxiety. CBD will actually help the inflammation that's still going on. You can also use the topical around the colostomy area. There may be some discomfort as well in the abdominal area. It will help to improve the inflammation of the lining of the remaining intestinal tract. Does CBD restore the stomach lining? What CBD does is that it helps to reduce the inflammation, not only in the stomach, but the intestinal tract as well. Does CBD help with diverticulitis? Absolutely, yes. Diverticulitis is inflammation of the colon. It helps to reduce inflammation. Diverticulitis can also have an aspect of bacterial infection. It is an antibacterial as well. CBD will help with diverticulitis and diverticular disease, yes. I was just diagnosed with gallstones. I have asthma. Can I vape at night? Yes, vaping at night. The onset of action of vaping or vape cartridges are love. The onset of action is within 1 to 5 minutes. Vaping will help you sleep at night. It will improve asthma because asthma, again, like all of the other chronic illnesses, is what? Inflammation of the lung fields. So it will reduce inflammation. It will help you sleep. And it will also help with the gallstones. You know, gallstones that become surgical have to be surgically removed, but definitely would help to decrease the inflammation that's going on at the time. IBS, inflammatory bowel disease, yes. CBD, there are many, many studies that show that CBD being an anti-inflammatory, having receptors in the intestinal tract, will help reduce not only pain and inflammation, but a lot of anxiety and depression that comes with chronic illnesses. And that's what I love about CBD. CBD has so many medicinal properties that it has side benefits, not side effects, but side benefits. Some of the side benefits in taking CBD for IBS is that you sleep better at night. Why? Because those receptors in the brain, serotonin and dopamine, help your mood and help you sleep. It also helps to improve inflammation and pain. So all of those things are side benefits that CBD has for you when you take it for IBS. Does CBD help for autoimmune diseases? Yes, fibromyalgia, lupus, sarcoid, scleroderma, all of those autoimmune diseases are a result of the body thinking that there is a foreign object. So it starts to attack the kidneys and the liver and the eyes and the skin. Because there is the endocannabinoid system, because there are receptors throughout the entire body, this is how CBD improves autoimmune diseases. Autoimmune diseases have a high activity of cells. CBD comes in and puts the body back in balance. It puts the body back in balance by reducing inflammation and the high inflammatory process that autoimmune sufferers have. How long does it remain in the system before you take more? Great question. So CBD actually remains in the system for about 3 to 4 days. But what you want to do is to get a steady state in your bloodstream. So you're going to want to start off with CBD low and slow. So starting off 2 times a day is what I recommend for my patients. 3 drops in the morning, 3 drops in the evening. And what I say is after 4 days, if your symptoms have not been resolved, then double that to 6 drops in the morning and 6 drops in the evening. But studies show that most people don't need a lot of CBD to get the body back in balance. So start low and start slow so that you have a very good result. I'm on dialysis. Will it help constipation? Absolutely, yes. We talk about how the endocannabinoid system regulates and modulates our metabolism, our digestion. So CBD will come in and help decrease the inflammation, will decrease the peristalsis or the movement of our bowel so that we are not constipated. It even does the reverse. If you have diarrhea or cycling constipation and diarrhea that we see in Crohn's disease, it also will help improve that. So what we're going to do now is that we are going to allow you to now contact the person that invited you on this webinar. The person that invited you on this webinar really, really cares for you. And they understand that we have a product here at Wakanna that is a very safe, effective, and very potent product that can really assist in so many things. Not only GI issues, but issues that we talked about earlier. By CBD being an antibacterial, it can also help with other issues. Bacteria that causes acne, or bacteria that causes diverticulitis, or bacteria that causes an infected gallbladder, for that instance. So we want you to contact the person that invited you on the line so that you can get your products, you can get your questions answered. In fact, I'm going to type here my email if you have any questions as well. Dr. Rita Mac at yahoo.com. You can use that email again for any further questions. We want you to get started tonight. We want you also to tune in next Wednesday, because each Wednesday we talk about a different chronic disease entity and how CBD can be beneficial to the body. So good night. We'll see you next Wednesday. Same Zoom link, same time. Have an amazing night. Thank you again. I'll put the recording on the Facebook page, Wakanna for Life Facebook page. I'll put the recording there in about an hour so you can share it with folks who did not make this call. Have a great night, and we'll see you soon.